Hi, this is my demonstration of a class that I am currently teaching for non-Spanish speakers. This is a conversational Spanish course for people of FEMA that are here working and in the recovery efforts for Puerto Rico. So I hope that you will learn something. This is intended to be the class number 6, which will cover the basic phrases that they will need to use in the when they are visiting a doctor, okay? So let's start with the parts of the body. And first of all, we will discuss different concepts of the parts of the body, which are the head, cabeza, then cara, hair, pelo, ojos, eyes, eyebrows, cejas, nose, nariz, ears, orejas, mouth, boca. And I will ask you, my students, to repeat after me the Spanish term, okay? Once that I point out the part of the body, they will repeat after me. Let's see. Las partes del cuerpo. Cabeza, cara, pelo, ojos, cejas, nariz, orejas, boca. All of the students will be able to repeat each of these parts, including the knee, la rodilla, el tobillo, the ankle, los pies, which are the feet, okay? The next part will be for them to listen to a little story that I will read for them. So they will identify what the story is about, and we can see after repeating the body parts if they got it, if they understood some of the terms, okay? So let's hear. Recientemente fui al hospital. Me dolía la cabeza, la garganta, los ojos, la nariz. El médico me puso una inyección con antibióticos, me recetó otra medicina y fui a la farmacia, pero luego descubrí que tenía infección. I recently went to the hospital. My head hurt, my throat, my eyes, my nose. The doctor gave me an injection with antibiotics. He prescribed another medicine and I went to the pharmacy. But then I discovered that I had an infection. So let's see if you understand what's the problem here. ¿Me dolía la nariz? No. ¿Me dolía el brazo? No. ¿Me dolía la cabeza? Sí. Students will answer correctly and they will demonstrate if they understood the concept. Then we will go to more vocabulary. In here, they will learn related terms that will be useful in case that they face an emergency while they are here, such as el accidente, la clínica, el consultorio, o como decimos en Puerto Rico, la oficina médica, el cuerpo, el dentista, si es mujer, la dentista, el examen médico, la farmacia, el hospital y el oído. Let's see the equivalent in English. El accidente will be the accident. La clínica, clinic. El consultorio, the doctor's office. Cuerpo, body. El dentista, the dentist. La dentista, the dentist. El examen médico, physical exam. La farmacia, pharmacy. El hospital, hospital. El oído, or sense of hearing. Once they discover that, we will continue to add more vocabulary. La operación o la cirugía, operation. La sala de emergencia o sala de emergencias, the emergency room. La salud, health. El síntoma, Symptom. Caerse, to fall down. Darse con, to bump into, to run into. Doler, dolor o duele, to hurt. Enfermarse, estar enfermo, to get sick, to be sick. An enfermo will be sick. More vocabulary, guys. Lastimarse el pie, to injure one's foot. Poner una inyección, to give an injection. Recetar, to prescribe. Romperse la pierna, to break one's leg. Sacarse una muela, to have a tooth removed. Torcerse el tobillo, to sprain one's ankle. Toser, to cough. Then we will share some symptoms and medical conditions such as el dolor de cabeza, headache, or a pain. La gripe will be flu. La infección, infection. El resfriado, cold. La tos, cough. Congestionado, congested, or stuffed up. There are also another medical conditions such as embarazada, will be the equivalent for pregnant. And then we will clarify here that you can get wrong to think that embarazada will be related to embarrass, which is commonly and mistakenly and wrongly, confused with that English word, but that is not a cognate, it is not valid. For embarazada, we use pregnant. To be embarrassed is to be avergonzado en español. Grave will be serious. Mareado, dizzy or nauseous. Médico or médica, medical. And saludable will be healthy. They will also learn that sano or sana, if you are referring to a female, will be healthy. Ser alérgico o ser alérgica a is to be allergic to. Tener dolor, to have pain. Tener fiebre, to have fever. Now, we will show a picture that will allow students to acquire some information from the picture. And we can see two different images there. In the left, we have a doctor, a female doctor, that is attending a sick male. And in the right, there's a nurse that is taking the temperature to a female patient. We will see, mark that on the wall, there are 3 posters, 2 x-ray images. One of them is showing an arm, and it's pointing to the left as the exit. Then in the middle, we can see a heart poster. And in the right, we are going to see, and we are seeing, a foot x-ray, okay? So based on that, we will ask, ¿qué hace la doctora? ¿Qué hace la doctora? The students should answer. The doctor is looking on the male patient's throat. La doctora está mirando la garganta del paciente o está examinando la garganta del paciente. The next question will be, ¿qué hay en la pared? ¿Qué hay en la pared? From that question, they will answer, hay 3 posters o 3 carteles, 2 de ellos de una radiografía, una del brazo y otra del pie. Y en el medio, un póster del corazón. At this time, they are able to differentiate from the different parts of the body, and they can point out this without any difficulty. ¿Qué hace la enfermera? Will be the next question. ¿Qué hace la enfermera? La enfermera toma la temperatura de la paciente, which is the image that we can find that we are looking at the right. ¿Qué hace el paciente? ¿Qué hace el paciente? El paciente mantiene su boca abierta o el paciente tiene su boca abierta. ¿A quién le duele la garganta? Who is hurting? The throat is hurting. El paciente, al paciente le duele la garganta. ¿Qué hace la paciente? ¿Qué hace la paciente? le toman la temperatura. ¿Qué tiene la paciente? La paciente tiene un resfriado because of the symptoms that are described in the picture. And the next part will be some common expressions that they can use, such as, ay, qué dolor, ay, qué dolor, oh, what pain. Creo que me rompí el tobillo. I think I broke my ankle. The next expressions will be, ¿cómo se lastimó el pie? ¿Cómo se lastimó el pie? The equivalent to, how did you hurt your foot? Me caí en la guagua. I fell when I was on the bus. Next, and a common expression will be, ¿te duele el tobillo? Does your ankle hurt? Which is the way of asking to, in a familiar way, distinguishing or differentiating between the tú from the second person singular and the usted from the second person singular too, but more formal. ¿Te duele el tobillo? That will be referred to a tú, to a second person on the singular. But if you are asking to an usted, showing some respect, which will be a formal question, it will be, ¿le duele el tobillo? Does your ankle hurt? Sí, me duele el tobillo. Yes, it hurts a lot. Another common question related to medical conditions will be, ¿es usted alérgico o es usted alérgica? You remember that you are, at this point, you're aware of the distinction that we have to make between a female or a male. And here, alérgico is referring to a male and alérgica is referring to a female. So, are you allergic to any medication? Sí, soy alérgico a la penicilina. Yes, I am allergic to penicillin. And here we can see another cognate, penicillina, which stands for penicillin. We're almost done in this lesson. Está roto el tobillo. Is the ankle broken? Roto will mean broken, and it's an irregular verb that we will be covering in the next lesson. Okay? You can answer to that, no está roto, apenas está torcido. No está roto, apenas está torcido. We will be, it's not broken, it's just twisted. And the doctor will say, le receto unas pastillas para el dolor. I'll prescribe some pills for the pain. Le receto unas pastillas para el dolor. The pills are also equivalent in Spanish to píldoras. But here in Puerto Rico, we prefer to call them pastillas, or even we can say medicinas or medicamentos. Another question will be, ¿te enfermabas frecuentemente? Did you get sick frequently? Referring to what tool? So the distinction is made in Spanish. Sí, me enfermaba frecuentemente. Yes, I used to get sick frequently. Tenía muchas infecciones. I used to get a lot of infections. No, no me gustaban las inyecciones ni las pastillas. I didn't like injections or pills. Okay? Now you are going to divide in pairs, and you are going to imagine that you are visiting an ER with a common flu. Let's have a conversation with your partner, and you are going to have a role model exercise where you can play as a patient and your partner as a doctor, okay? So you are able to choose from these questions as a doctor and the other examples that we already gave from the patient point of view, okay? We will discuss them in the front. Thank you.